Really, this is just the beginning. We're aiming to build this project and ensure that its long-term sustainability rests on the foundation of great responsive journalism. Mia came to me in 2013 to talk about the state of health journalism in South Africa and the region, and to start to float an audacious plan that we could leverage non-profit funding to build a much more capable health journalism unit at the Mail and Guardian, infuse that into our coverage, and act as a bit of a beacon for the rest of the sector.
We initially had funding for only 18 months. So I thought, having worked for NGOs before, maybe the funding would last for 4 or 5 years. I didn't envision 10 years. So Bhekisisa is a Zulu word, which means to scrutinize. And at Bhekisisa, we scrutinize medical issues and we break them down, or we look closely at them. I think it's exactly what Bhekisisa has done in the past 10 years, so I think we've lived up to the name.
Bhekisisa set out in search of impact, and that was really defined as impact on policy, impact on the quality of the public health conversation, and ultimately then impact on the lives of people that are affected by policy.
I think it was in 2013 where we went to Pondoland, where there is very often problems with injuries as a result of traditional circumcision. The doctor who we interviewed was flown in by the health minister at the time to come to his office and have input in policies for safer circumcision. But my favorite impact of that story was that the Wits drama department wrote a play and had it performed by the National School of the Arts. We left the Mail and Guardian in July 2019, which is 6 months before COVID started. We didn't know pandemic was going to start, but it was strategically a very good move for us, without knowing what was going to happen.
So Bhekisisa played this real public health role, not just as a informant, but also as a kind of tool that people could use in making their own health decisions on a day-to-day basis.
Because South Africa played such an important role in the global conversation around COVID, Bhekisisa made a global contribution.
I'm joined by Mia Malan, Editor-in-Chief of the Bhekisisa Centre for Health Journalism, based in Johannesburg.
It's not a news organization that kind of flourished or gained prominence during COVID. Ordinary people became exposed to Bhekisisa's work. But I think that it is important to give credit where credit is due, that long before this moment, Bhekisisa was onto a winning formula and tapping onto something that was particularly urgent. And certainly as a radio show host, a talk show host at the time that they were birthed, I used a lot of their stories to generate commentary.
There's this kind of global role that health journalists are playing, and particularly in that ecosystem, health journalists who have a solutions journalism orientation, so not just highlighting problems, but also highlighting attempts at solutions. And I think that's a very unique niche that Bhekisisa has come to occupy.
We've heard about game changers, from a minister who's a game changer in the TV world.
It's just been amazing to see not just their work in written journalism, but also in audiovisual outputs.
we started doing more video production, and we included more data journalism in our work. So in 2022, we started Bhekisisa TV in a production called Healthbeat.
It's a silent killer, say those who live here.
We've got a problem with the air pollution here.
But Bhekisisa particularly stands out for how they have expanded the understanding of what health is. Health is about how you are able to access healthcare and so many other factors that Bhekisisa is able to highlight. Also, not what's happening just locally, but at a big policy level as well, in ways that people like me can engage with and understand what's happening in the space. A story from Bhekisisa, but one I will never forget is Slice of Life, which focused on Choice of Termination of Pregnancy Act. It was just such a striking piece.
Happy birthday, Bhekisisa!
Ah, wow, 10 years already. Bhekisisa can certainly not be called a baby anymore. And in fact, even when Bhekisisa was a baby, I'm not sure that we could actually call it a baby because of the formidable journalism that Bhekisisa produced. I am particularly inspired by that nexus of health and social justice that you steadfastly pursue, and it is what South Africa needs.
My hope is for Bhekisisa to survive and flourish as an organization with a quality and a solid product. That doesn't mean it has to be exactly the same product that we have now. It can adjust. And it doesn't mean it has to have me as a head. But what it needs to be is a solid, credible, trustworthy product. If it does that and it's able as an organization to adjust to how the media landscape evolves naturally, then I'd be very happy.
Happy birthday, Bhekisisa. I couldn't be prouder of how you've grown.
Cheers to another 10 years.